Hey YouTube, this is Catching Up with Crystal. Can you keep up with me? Because you never know where I'm going to be. And today I'm out here for a walk. I just wanted to follow up with you guys for those of you who are interested in giving CDL physicals. I have done, not a whole lot, but I've done some. So I wanted to give you some feedback, and that's what this video is about. When you begin your first physicals, you may or may not make some small mistakes. Luckily, I had somebody that trained me pretty good, and she told me, you know, you're going to at least make one mistake when you do your first physical. And my first mistake was that, and I don't know if they do this everywhere, but where I am currently doing physicals at, it is the provider who, once you print out the certificate to give to the driver, you then fax it over to motor vehicles. So my very first one, I did a physical. Everything went good. I did everything the right way, and gave him his certificate, and he got a letter in the mail. He called me and said that they said they never received the certificate, and that that he had a certain date to prove that he had his CDL physical before the expiration date, because they lose their licenses. So luckily it was not a big deal, because we had done the physical within the time frame prior to his CDL license expiring. So I put this little video together for you. It's a little choppy. It's the things that you're going to need. It's actually not hard. You don't need a lot of fancy equipment to do a CDL physical. You really don't. You need an examination table. You need a blood pressure cuff. You need a something to look in people's eyes, ears, nose. You can use a Snellen chart, and you can do the whisper test. You don't need an audiometer machine, and you don't need a fancy eye machine to check for vision. But anyway, with that being said, and I already been talking too much, the rest of the video is going to be what you are going to need. You're going to need a blood pressure cuff, of course your Welch Island to look in the ears, look in the eyes, look in the nose, pulse ox, and be able to check for urine. And you will need the application. A Snellen chart, which test your vision, and you have to be able to be at 20/40 in both eyes. Or if you have a machine that can test for vision, an audiometer, which tests your hearing, but if you don't have an audiometer, you can do the whisper test, where the person has to be able to hear you from at least 5 feet away or greater. You don't have to have fancy schmancy machines, just be able to do the whisper test. You turn your back, you have the patient cover one ear, you whisper a word and they repeat what it is. Then you have them switch ears and you turn your back to them. You're at least 5 feet away and you say a word and you have them tell you what they said, and that's the whisper test. You don't need a lot of fancy equipment. All right, guys, this is what the application for the U.S. Department of Transportation Federal Motor Carrier Safety Administration application looks like. So it's clearly marked. The driver is going to fill out the blue section. So they are going to fill this portion out. That is not for you to fill out. It should be filled out in its entirety. You want to double check after that they have completed the application. They're going to turn it back over to you that everything is completed. You want to ask about their surgical history. Have you ever had a surgery? If yes, you do want a full detailed explanation of the surgery. I'm not sure how they can say not sure, but it's true. Some people mistake a procedure for a surgery, so you want details. Are you currently taking any medications? That's relevant because certain medications will disqualify a driver. So once again, this application, the blue part is for the driver, and you are responsible for holding on to this application. You should have a place to secure the application so that if you're ever audited or the driver's audited, that you can provide proof of the physical. Here are questions. For example, have you ever had a head or brain injury or illnesses, any seizures, epilepsy, eye problems, yada yada, ear problems, head and neck, whatever. So if there's not a condition that's listed up here, they have a space that they are able to write in here. Also, did they answer yes to any of these from 1 to 32? If they did, then there is a box here that they are able to elaborate on those conditions, and then they are going to sign the application, okay, that they understand that the information is accurate and it's complete, and that they should not do any false or misleading information because it may invalidate the physical. And I have a recent man who was 81 years old that tried to be tricky with me. So some of them will be slick. Some of them will try to downplay their health history. Now, the green part is to be filled out by you. What you're going to do is you're going to review all of the responses that the driver has provided, and you want to review this and discuss those answers with the driver. You want to review their medical records if they have any, such as if they have a history of sleep apnea, are they on a CPAP, and you want to have that report. It has to be, there's a criteria. I'm not going to give that away to you. Do your studying. Next thing is still your responsibility. You're going to do vital signs. The temperature is not necessary, but the blood pressure is, because this can be disqualifying if it's too high. If they didn't follow directions from the last exam, you told them to go get medicine, they didn't. There's different things, but you really have a lot of, you have the ability to some leniency. However, if they don't follow your instructions, you can disqualify them. Urinalysis, we are not looking for drugs. We are interested in the specific gravity, protein, blood, and sugar, because that is going to indicate some issues with the kidneys or diabetes. The vision is important here. Now, you don't have to have a special machine. Like I said, you can use the Snellen's chart. However, the standard is that they must be able to see at least 20/40 in each eye with or without corrective lenses. So it's okay if they have glasses. They just need to be 20/40 and at least 70% field vision. That's their peripheral vision. You want to document it there. Their hearing. Now, you don't have to use an audiometer. You can do the whisper test. And so you would document in each ear that they are able to hear at least 5 feet. And I went on and explained already, or I will in the video, what the whisper test is. There are questions on the audiometric test results. You have to know how to do the formula, to do the math, to come up with the average. And then on the physical examination part, you're going to check any abnormal findings that you find. Overall, how are their appearance? Is the skin normal or abnormal? How about the eyes, the ears, the mouth, all of that. Abdomen, you want to make sure they don't have any hernias. And as you know, if you hear a bruit, that is an emergency. You want to get them to the emergency room right away. Okay. And on this last page, the reason I'm blocking this is because somebody pre-printed their information on there as far as this, another examiner. She put her information in there, so I don't want you to see her information. But here where it says the medical examiner determination, see that? Okay, that's where you're going to determine how this person is qualified. Are they qualified wearing, do they meet the standards for a 2-year certificate? Are they qualified for 3 months, 6 months, 1 year, or other? Wearing contact lenses, wearing a hearing aid? Do they have a exemption? Do they need a skill performance evaluation? Make sure you know about that. That is it. So that is the application, and very self-explanatory, just so you are aware. They complete the blue part, you complete the green part, and don't fill it out for them. And make sure that you review any health history. Make sure that if they have a CPAP, that you have a report. And this is really not hard to do. This is the home screen for the Federal Motor Carrier Safety Administration. This website is the website that you would access in order to perform CDL physicals for your clients, patients, however you want to call them. In order to be able to perform these specified physicals, you have to be licensed, certified, and registered to perform the physicals. It has to be by a test. Check out my other video for that. Once the FMCSA has verified that that you have passed the test, you will have your name added onto the list. So you will scroll down. This is just a shortcut to get to it. Click on that link. It's going to take you to this home screen here, and you just log in, put your login information. Okay, so this is the screen that you're going to enter in the driver's information on the Federal Motor Carrier Safety Administration. I blocked out my information here. Here would be your number and your name and your national certification number. To enter in a new driver, you're going to go under medical driver, CMV driver medical examinations. You're going to click add new, and when you add new, it is going to give you a screen where you're going to be able to click down. Your drop down box will be your certification number. Here you would enter in the driver's information. It's all very self-explanatory, and then you would submit the information. Once that's done, it gives you a screen that allows you to say how long the person is being certified for, whether it's pending, 3 months, 6 months, a year, 2 years for full certification.